Hey everybody, this is Justin with Atlas. September is our healthy aging month, so I wanted to make a quick video to discuss how to maintain your mobility and strength through the process of aging. Physical abilities decline with normal aging. That includes strength, swiftness, and stamina. In addition to these muscle-related declines, there's also changes that occur in coordinating the movements of your body. Changes in strength, swiftness, and stamina are all associated with decreasing muscle mass with age. Although there is not much decline in your muscles between the age 20 and 40, after the age of 40, there can be a decline of 1 to 2% per year in lean body mass and 1.5 to 5% per year in strength losses. Let's take a deeper look into why we lose strength, mobility, and coordination through the process of aging. With increasing age, we lose muscle mass. Lean muscle mass contributes up to 50% of the total body weight in young adults, but this decreases to 25% by 75 to 80 years old. The total number of muscle fibers is significantly reduced with age, beginning at about 25 years old and progressing at an accelerated rate thereafter. In addition, the capacities for muscles to undergo repair also diminishes with age. This is due to changes in the endocrine system, such as increased insulin resistance, decreased growth hormone production, reduction in estrogen and testosterone, vitamin D deficiency, and increased parathyroid hormone. Changes in the white matter of the brain are the cause of coordination challenges as we age. Changes to white matter in the brain can disrupt the connections between important brain coordination centers, such as the frontal lobe, which directs movements, and the cerebellum, which provides on-the-fly corrections to those movements as needed. These two brain centers need to work together to coordinate movements, and this changes as we age. It becomes more difficult. So we learned about why we lose strength, coordination, and mobility throughout the process of aging, but what can we do about it? It turns out that the most important causes of reduced strength and coordination with aging is simply due to reduced levels of physical activity. There's a myth in our society that it is fine to do progressively less exercise the older you get. The truth is just the opposite. As you age, it becomes more important to exercise regularly, perhaps even increasing the amount of time you spend exercising to compensate for the bodily changes in hormones and other factors we already discussed that you cannot control. So let's talk about some general guidelines for how much physical activity you should be doing throughout your week. Try brisk walking, jogging, biking, swimming, or aerobic classes at least 30 minutes per day, 5 days a week, to cover the amount of aerobic exercise that's necessary. Also, try to incorporate some strength training. An increasing amount of evidence is showing that strength training improves and maintains core strength. Building muscle mass is another safeguard for staying mobile and strong through the process of aging. Try yoga, tai chi, Pilates, and weightlifting. You should be doing direct strength, balance, and flexibility work at least 2 hours a week. In addition to aerobic exercise and working on your strength, balance, and flexibility, you should also find some physical activity that you genuinely enjoy to do. Practice sports that you want to improve at, such as golf, tennis, or basketball, something that's going to keep you moving. Take advantage of lessons from teachers and advice from coaches and trainers to improve your exercise skills and get more involved over time. We talked a lot about exercising to maintain your strength and mobility. Is there anything else that we can do outside of exercising to help maintain those things? The short answer is yes. Work with your doctor to treat diseases that can interfere with your ability to exercise, including orthopedic injuries like sprained ankles or wrists. Work with an eye doctor for cataracts and other eye problems that might challenge coordination of movements. You should also focus on fueling your body with healthy foods. Fuel your brain and muscles with a Mediterranean menu of foods, including fish, olive oil, avocados, fruits, vegetables, nuts, beans, whole grains, and poultry. These are going to allow your muscles to work at their greatest capacity and allow your brain to continue to provide for those muscles as well. It's also incredibly important that you're getting enough sleep. Older adults need about the same amount of sleep as all other adults, 7 to 9 hours. Lack of sleep increases your risk for serious health conditions like high blood pressure, cardiovascular disease, diabetes, and obesity. Studies show that insufficient sleep puts added stress on the body, leading to inflammation and a weakened immune system. Lack of sleep can also weaken your decision-making ability and your long-term memory as well. Over time, too little sleep can also contribute to cognitive decline, memory loss, and increase your risk for developing dementia. It is incredibly important to get enough sleep so you can continue to do the things that you love to do and maintain your strength, mobility, and balance. Let's put all of that together. Maintaining mobility and strength with age takes a lot of work. A combination of physical activity, a nourishing diet, and proactive recovery become more important as we age. Try to use some of the guidelines I discussed to make sure you're getting enough exercise and treating your body the way that you need to in terms of your nutrition and your sleep and diet and everything else around that. And as always, if you have any questions or you need any guidance or anything else in between there, please feel free to come see your Atlas providers. We are more than happy to help you out and talk through any of this with you. Thank you.